Hello, my name is Erica Starling. The DMP topic chosen focused on victims of sexual assault in the Alabama Crime Victims Compensation Program. The title of this project is Training Sexual Assault Nurse Examiners and Patient Advocates to Improve Utilization of the ACVCC Program for Sexual Assault Victims. Sexual assault victims are considered an underserved population due to the challenges they face in receiving care following an assault. Once an assault occurs, it is often a difficult process for the victim to receive care. Sexual assault clinics are designed to help ease the stress and anxiety resulting from an assault by providing medical care and referrals. Trained SANE within clinics speak with the patient, refer them to appropriate follow-up resources, and complete sexual assault examinations. Patient advocates provide support and aid victims in any way needed. One of the resources patients from Alabama may consider is the ACVCC program. ACVCC is a valuable yet underutilized program that assists victims in securing funds for follow-up medical appointments, mental health care, funeral costs, work loss compensation, victim rehabilitation, and legal fees and representation. Project design. The DMP project is a quality improvement project that focuses on the improvement of outcomes for victims of sexual assault. The project took place in an urban sexual assault clinic in Northwest Alabama. The mission of this clinic is to provide 24-hour compassionate patient-centered health care, advocacy, and counseling services to those who have experienced sexual assault so that each person is empowered to begin the healing journey. The clinic also provides medical treatment for specific sexually transmitted infections and support during pregnancy. The clinic employs approximately 15 to 20 nurses and 20 to 25 patient advocates, with 20 to 30 patients presenting to the clinic for a sexual assault examination each month. This clinic serves the 9-county Northwest Alabama region that includes Tuscaloosa, Bibb, Fayette, Greene, Hale, Lamar, Marengo, Pickens, and Sumter counties. Any patient aged greater than 13 years old, regardless of gender, who have experienced a sexual assault can be evaluated at this clinic. Victims who do not wish to submit information to law enforcement can be treated and information be provided anonymously to law enforcement. According to the Rape, Abuse, and Incest National Network, every 68 seconds an American is sexually assaulted. However, despite these high statistics, only 25 out of 1,000 assailants will be sentenced to prison. It is estimated there are 433,648 sexual assaults each year. RAINN defines sexual assault as non-consensual sexual contact or behaviors. Sexual behaviors can include fondling, unwanted touching, attempted rape, oral sexual acts, and penetration of the victim and or perpetrator's body. Rape is a legal term which describes a type of sexual assault that includes penetration of the vagina and or anus with any object and or body part or oral contact with genitals without consent of the victim. Statistics indicate approximately 15% of individuals who are sexually assaulted are aged 12 to 17 years, 54% are aged 18 to 34 years, 28% are aged 34 to 64 years, and 3% are aged 65 and above. RAINN also reports that 1 out of every 6 women have been a victim of rape or sexual assault in her lifetime, with 90% of rape victims being female. For the DMP project, the focus was the underutilization of the ACVCC program at the sexual assault clinic. The victims of assault are rarely assisted in the application process for the ACVCC, which led to an underutilization of the services offered. The victims were not receiving the compensation available, which created an opportunity for this quality improvement project. The project focused on training sexual assault nurse examiners and patient advocates in the correct application process for this vital resource. According to the National Association of Crime Victims Compensation Boards, compensation programs offer financial assistance to victims of violence, which can be crucial following assaults. By providing financial assistance, it can assist in restoring both the victim's physical and mental health by replacing lost income and or funding for the care received. A needs assessment was conducted using evidence-based research and conducting both a gap analysis and SWOT analysis at the project site. The needs assessment focused on the compensation program available for victims of sexual assault in Alabama. The Urban Sexual Assault Clinic is an invaluable resource for the northwestern Alabama area. The clinic provides safe, confidential, trauma-focused care for individuals who have been victims of sexual assault. Currently, there is an underutilized resource available for victims of sexual assault. The ACVCC has a grant in place which assists victims of sexual assault with financial compensation for various expenses that accumulate after they have been assaulted. In the state of Alabama, there were 1,075 sexual assault claims made to the ACVCC, with $527,895 paid via the compensation program. In the clinic's individual county, there were 77 sexual assault claims made, with $75,946.13 approved for use. According to the director of the sexual assault clinic, the ACVCC program was not being utilized by staff to provide information on and assist victims in the application process. Without the staff and advocates informing the victims, they were unaware of this valuable resource available to them. This led to an underutilization of the compensation benefits available for victims. Learning objectives. The project focused on the correct application and usage of the ACVCC program. The preceptor and student worked closely to develop educational materials for the staff. The staff participated in a pre-test and post-test after the educational session. The objectives identified for the utilization in this DMP project focused on the clinic nurses and advocates being able to complete an educational course supported by evidence to improve their knowledge of and skills in using the ACVCC program, describe how to utilize the ACVCC program, employ the application techniques learned to assist victims of sexual assault to correctly apply for the ACVCC program, prioritize the use of the ACVCC program application immediately following the educational intervention, modify current practice to include the application of the ACVCC program, and to include follow-up to verify that the victim has achieved approval or denial status, achieve at least 90% on the post-test after the educational session, and obtain 100% compliance in the application and utilization of the ACVCC program within 2 months of education. The PICO asked and answered during the project was, does educating sexual assault nurse examiners and patient advocates about the Alabama Crime Victims Compensation Program compared to provision of no education increase utilization of the ACVCC program by victims of sexual assault? The theoretical framework to correctly identify areas requiring intervention and successfully progress towards the needed change, Havelock's 6 stages of planned change was applied. The 6 steps included building relationships, diagnosing the problem, gathering resources, choosing the solution, gaining acceptance, and self-renewal. Relationship building is where the needed change was identified. The second phase was decided by the change agent and determined if the change was warranted. The third phase acquired the resources available for change while gathering information. The fourth phase selected a change pathway from the available options prior to the implementation phase. The fifth phase ensured the change was seamlessly integrated along with the effective communication, education, and adequate support systems. The last phase included monitoring to ensure the change was stabilized and maintained. The DMP project was framed utilizing Havelock stages of planned change. Relationships were built with the urban sexual assault clinic and director of the facility, along with employed nurses and advocates. There was an underutilized resource available for victims of sexual assault. Review of literature. A literature review was performed with the following primary considerations: best practice in caring for victims of sexual assault, compensation programs available for victims, and general sexual assault considerations. The databases used were CIN, AHL, and PubMed, utilizing heading and keywords with recommendations by the Professor of Health and Services Librarian at Houston Cole Library. The following keywords were utilized in both CIN, AHL, and PubMed: sexual assault, compensation, sexual assault nurse examiner, sexual assault victims, SANE, and reporting. Results were narrowed by utilizing peer-reviewed academic journals and publications within the past 10 years. Unfortunately, there was not literature specifically related to the ACVCC and its use in sexual assault programs. Therefore, the literature review focused on sexual assault victims, how formulated programs assisted victims, and other compensation programs in the country that aid victims in order to assist with the development of and teaching related to this project. Design methods. The design was a quality improvement project for a rural sexual assault clinic. The DMP student completed a training course with the ACVCC program and developed a clinic training course for the sexual assault nurses and patient advocates. The student then educated the nurses and advocates on the proper application process to assist the patients in applying for the ACVCC program. The implementation framework utilized was the Knowledge to Action framework. This applied framework helped individuals deliver knowledge in a sustainable, evidence-based interventions. The ACVCC has been shown to assist victims with cost accruing after being assaulted. By utilizing the K2A framework, the student was able to apply this information into an educational session that taught the staff at the clinic on proper application techniques. There was a pre-education survey that was created by the student and preceptor that was taken by all of the participants to evaluate their knowledge of the ACVCC prior to the educational sessions. The staff of the sexual assault clinic were given dates to sign up for mandatory training. Once dates were determined, the student and director of the clinic discussed information that would be presented. Project implementation. The education was presented via PowerPoint education. The education included explanation of the consent form, PICO question, and the DMP project title. The ACVCC mission and definition was discussed, and staff were provided the opportunity to ask questions. The purpose of the project was then discussed and explained. The history of the ACVCC and how the compensation program was developed was discussed. Staff were then educated on the funding amounts available for victims and what criteria must be met to apply. The application was discussed in detail with instructions provided. Staff were then educated on how to properly submit the completed application and check the status of the application. After the teaching and implementation session were completed, post-education surveys were given to the staff and advocates to ensure they felt knowledgeable and prepared to teach victims of sexual assault on proper application techniques. Outcomes. There were 19 individuals educated, 3 patient advocates, and 16 SANEs. All individuals completed the consent form and pre- and post-intervention surveys. The years of experience of the nurses and advocates in sexual assault nursing varied between less than 1 year, 1 to 5 years, and greater than 5 years. Out of the 19 individuals who attended the educational session, only 1 nurse had utilized the ACVCC program previously. The staff completed a pre-education consent form and pre-survey, which found many of the staff had not completed an application with ACVCC previously. After the educational session, the staff completed a post-survey, and the individuals who attended, 19 in total, scored a 90% or higher on the examination. Conclusion. Sexual assault is a health concern for all individuals, regardless of age, race, or gender. Following a sexual assault is often difficult for victims to receive the appropriate care they require. There are various barriers which prevent victims from receiving adequate care. Overcrowding in emergency departments, lack of nursing experience in sexual assault, fear of judgment, and fear of reporting often prevents victims from seeking assistance. Sexual assault clinics were formed and are now available for victims to visit and receive appropriate care, which is also trauma-centered. SANEs are available to complete medical and forensics examinations as well. In the state of Alabama, the ACVCC is an invaluable resource available to victims. The ACVCC provides financial compensation to aid victims in the post-assault phase. This program provides funding for many different categories, which is crucial for victims who are struggling to return to normalcy. This DMP project focused on the underutilization of the ACVCC program at the sexual assault clinic. After the project educational session, all SANEs and advocates stated they would immediately incorporate the application into their sexual assault examinations. These clinic staff members also verbalized that they would educate future SANEs and advocates on the application process. Sustainability. This project aligns with the clinic's philosophy and mission. The staff of the sexual assault clinic will continue to assist victims of sexual assault in the application and utilization of the ACVCC. New staff members will be educated on proper application techniques. The director of the clinic will continue to encourage the use of the ACVCC and will speak with other clinics regarding this resource. The application process will continue to improve and become seamless. The clinic will continue to perform quality improvement processes to ensure that the victims are cared for in an appropriate manner. Acknowledgements. I would like to express my thankfulness and gratitude to the facility of Jacksonville State University for their instruction and support during this program. This program was a valuable learning experience to create better patient outcomes and provide a higher quality of care in both my advanced practice nursing career and education. References. Thank you so